we now move on to our next presentation. Again, it's one of the abstracts that has been presented. So I will let Mary Sang sing.
Thank you so much, Chair.
Yes, go ahead, Mary.
So my name is Mary Sang. I work in Baringo County. I'm the M&D officer. And this presentation is just a little bit about what we're trying to do in Baringo, just to increase or improve financial security in mostly our hospitals. So when you look at the Public Finance Management Act, it's what regulates public finances, how they are supposed to be collected, banked, and used. But the idea was good when the act was being enacted, because it was just to have some control over public finances. But the problem was now all hospitals, all revenue generating institutions must bank in the county revenue fund. And you know, once you bank it there, you can't easily access it. So it becomes very difficult sometimes for institutions like public hospitals to access these funds. So this reduced autonomy over financial management. So as a hospital, you're an institution, but you basically don't have complete control over the finances you collect. And sometimes there are delays in procurement. So sometimes in essential supplies, you reached your reorder level, you make your order, but now you cannot access the funds until they go through the processes. So you end up getting stocked out and all that, and leading to, you know, service delivery that isn't optimal. And then another challenge is that there's a decline in donor support directly to facilities, because now you cannot interact directly with an investor or a donor. They would shy off from assisting financially, knowing that the money goes to a county revenue fund. So if there was a way the hospitals could have direct access to their revenue or their funds, then they would be able to do much more to, you know, increase their autonomy, improve their service delivery and everything. So an opportunity is the FIF bill. FIF stands for Facility Improvement Fund. Maybe other counties call it something different, but the idea is that it is a legislation that the county can put in place just to try and it's like a bylaw of the Public Finance Act, so that they have more autonomy over their revenue. And this is what I think many counties are trying to do, including Baringo. And the idea is just to ring fence revenue that is collected by health facilities. And of course, it's not easy. Legislation, you have to have a series of stakeholder meetings. You have to have on board the legislators to sensitize, to lobby. And all these are not cheap. These are quite hefty financially. So there's a county, at least just took an example of one that has already enacted this in the county, that's West Pokot. They did this in 2019. They enacted it in 2019. And in the first quarter, between the first and second quarter, there was an increase, which, as I'll explain, could be attributed to that. I know there was a decline in the third quarter, but that is between January and March of 2020, because that's 2019-2020 financial year. But like I said, this could be attributed maybe to the effects of the pandemic, like I'll show you here. So there was a marked increase in the second quarter, but a decline in the third quarter. So because it's still early during the implementation, it's quite early to really show a trend, but I just took it as an example just to show that there's really hope if we do legislation. And so because of the decline in the patients visiting hospitals countrywide, this was a countrywide or even global result. So what we learned that what we can learn is that facilities are able to collect funds and retain them for the purpose of improving service delivery. And when there are delays in disbursement of funds, for example, from the National Treasury, everyone knows counties have to wait for their allocations. And sometimes when the financial year is beginning in July, we experience delays. So it means hospital activities will be put on hold, because now you have to wait until the funds are disbursed. Once they come to counties, again, you have to do your requisitions. This may take time, and this really interferes with service delivery. So in conclusion, if we implement bylaws that provide for hospitals or even any public health institutions to have rights over the revenues they generate, it will go a long way in enhancing their financial security. And of course, once this is improved, it will provide for a more robust supply chain. There'll be improvements. Thank you so much, and back to the chair.
Thank you, Mary. Very concise presentation.